So let's see who has the first one. Vicky.
That's me.
Okay.
Okay, so the question is, a patient with apparent symptoms of hypothyroidism, what laboratory tests would be the most appropriate to perform?
Mm-hmm.
So first of all, should I describe the symptoms of
No,
hypothyroidism
you don't.
or?
If it's asked, you can do it. Okay, so do
Okay.
it. You are free to
Oh.
do whatever you like.
Okay, so well, the main symptoms are, I think, they were weight gain, fatigue, cold intolerance, bradycardia, constipation, and the list goes on. Memory loss, hair loss, things like that. For the lab tests, you can measure the TSH levels, the thyroid stimulating hormone levels, and the T3 and T4 levels. And so basically for hypothyroidism, there are three that you can look for: the primary, secondary, and tertiary. So
yes, but first of all, you have to look whether it's primary or not. So what you do, measure TSH and T4. That's it. Yes?
yeah,
Okay,
yes.
this is the first. After you can think about what will happen if we do have a large TSH and decreased T4. Yes?
Yeah.
That means primary
Yeah.
hypofunction. What kind
Yeah.
of test you are going to perform if you do have a primary hypofunction?
And the anti hold on. The anti-thyroid thyroglobulin and anti-peroxidase antibody tests.
Okay, this should be checked to rule out Hashimoto thyroiditis, for
Yeah.
example. And additionally to these antibodies, what else?
Um,
The imaging technique, the radioactive iodine uptake, and scintillation scan.
the scintigraphy. Okay.
Scintigraphy. That's it. That's it.
Okay.
That's it. Okay. Next one, if you do have a decreased TSH and decreased T4. Now, in this case, you do have, first of all, the TRH test. Yes. And measure whether the gland or TSH level or the T4 level increases or not. MRI to see what's happening in the pituitary. That's it.
Okay.
That's it. That's it.
Okay.
Nothing else. All right. Good.
All right.
Now let's see the next one. Jessica.
Hi. A 40-year-old woman seeks evaluation for subfebrility and diarrhea commenced 2 to 3 weeks before. Blood glucose is 6.6 millimoles per liter. Blood pressure is 160/85. Heart rate 120 per minute. Serum TSH is decreased. The free T4 is elevated. The TRAB titer is elevated, and it's TPO antibody positive. And since she has the kind of fever and diarrhea and high blood pressure, with also the increased free T4 and the decreased TSH and the rest of the lab findings, I would say this is most likely Graves.
Graves positive diseases. Okay, what other test?
Could you do the ultrasound and the scintigraphy and
exactly
cytology?
radioactive iodine scintigraphy and ultrasound? That should be enough. Yes, that's enough. Okay, good. See, simple question. What is Sarah?
Yeah, so a 42 years old woman developed diffusely enlarged painless thyroid glands. Total T4 is decreased, thyroid uptake of radioiodine is low, ECG reveals low voltage and bradycardia. The thyroid autoimmunity panel demonstrates the presence of TGAB and TPOAB. What is the most likely diagnosis? The condition characterized by hypo or hyperfunction of the thyroid gland. Firstly, I'll say it's a hypofunction because we have bradycardia, we have the enlarged thyroid, and also because we can find some antibody present. I would say that's an autoimmune disease, so most probably it's a Hashimoto's.
Thyroiditis, exactly.
thyroiditis.
Hashimoto
Yeah.
thyroiditis. Again, you have to do the scintillation scan, ultrasound, other thing, but
Yeah.
that's a Hashimoto, and you have to substitute with a thyroid hormone. That's it. That's it. That's an easy, busy question. Okay, good. Next one, Suyong. Oh, Sangwon.
It's me. Yeah, it's can call.
Okay, good.
Oh, a schoolgirl at the age of 14 without any complaints developed diffusely enlarged, painless thyroid gland recognized accidentally by the school doctor. Laboratory findings are FT4 is slightly decreased, whereas total T3 is slightly elevated. Thyroid uptake of radioiodine is increased. FT4 gets normalized after treatment with inorganic iodine. What is the most likely diagnosis? Trying to interpret the opposite change in the hormone. Um,
No, let's see.
there's a diffusely enlarged, painless thyroid gland, so goiter.
Uh-huh.
Can be iodine deficiency or Hashimoto or subacute thyroiditis.
Mm-hmm.
But the inorganic iodine normalized the T4 levels, so it's probably the iodine deficiency.
Mm-hmm.
Um,
Okay. How would you know that the iodine deficiency is this one, beside of this administration of the inorganic iodine? What would happen if you measure, for example, iodine uptake in a case of Hashimoto thyroiditis and in a case of this iodine deficiency?
so if there, so the isn't won't the T4 be converted into T3?
Let's think a little bit. Okay, let's think a little bit. In a case when we do have iodine deficiency, the
Yes.
gland is intact. But
Yeah.
because we do have less iodine, less active T4 can be produced because we do have a decrease, slight decrease of T4. What will happen? There is no feedback for TSH. So we do have a very highly increased TSH level. So far is identical with Hashimoto, as we do have a high TSH level and a low T4 level. Now, what will happen when we do have a very high TSH level? The gland enlarging and hypervascularized to be more active to filter out the iodine, the small iodine, to the gland. Okay. Now, if you give radioactive iodine to this patient, what you detect? You detect this gland is hyperactive, so you are going to detect a very high uptake of the iodine. Yes?
Okay.
However, in Hashimoto, when you do not have a normal thyroid function, this is not going to increase the iodine uptake. So that's be low, meaning that we don't have normal living cells. So in a case of iodine deficiency, the TSH stimulates the gland to make it more active. In Hashimoto thyroiditis, it doesn't do anything with the gland. Okay?
Okay.
So this can be a very big difference between, but itself, if you use, for example, anti-TPO or anti-thyroglobulin, that again can show that this patient possibly does not have Hashimoto thyroiditis.
Okay.
Okay.
Great.
Now, in additional here, that they're asking that what is that opposite change of the hormone? So why the T3 level increased, why the T4 decreased? This is a, let's see, regulatory mechanism in the gland. If you don't have enough iodine, the gland itself will release more T3, that because T3 has less iodine as T4.
Right.
So relatively, that's this is another thing that's showing that we don't have enough iodine. Okay,
Yep. Okay.
good. Now let's see. I think this is the fifth question doesn't happen, and I will tell you why. Okay, Sabine.
Yeah.
Fifth question number 5.
What did you say?
Okay, you can read it.
What did you say? Sorry.
I said that this question is not happening in the true life.
Oh, okay. I thought it was congenital hypothyroidism. And maybe causing cretinism.
Okay, now this is why it's not happening, because they are not waiting for 11 months, because they are checking right after delivery how the thyroid hormone levels and the TSH and T4 level changing. So this is not going to happen. And this baby has a hypothyroidism that possibly due to an enzyme defect, a hereditary enzyme defect, when we do not have the conjugase enzyme. And this is why the monoiodinated tyrosine and the deiodinated tyrosine is very high. So the organification of the iodine is failing. So that's a hereditary problem, and that can cause cretinism, but this is not happening for sure.
Okay.
Okay, so I think this question won't be given. Now, let's see the last one. That's very easy question.
Okay, so list those thyroid tests that are considered helpful in the diagnosis of thyroid cancer.
Mm-hmm.
We can use ultrasound,
Mm-hmm.
scintigraphy, needle biopsy,
Uh-huh.
and also we can look at the thyroglobulin concentration of plasma
Okay. Okay.
and calcitonin level.
Yes, calcitonin, very good. You should look at the age of the patient, whether a girl or male, for example, because girl most commonly benign one, man, young man most commonly the malignant one, hyperfunction more commonly is benign one, hypofunction, cold nodules, for example, most possible is malignancy. So these are those things that you should consider when you talk about, let's say, some kind of cancer or not. Okay, that was good. Okay.